Hello, and welcome to the Next Level Podcast. Today, it's back to the dynamic duo of Dr. Kwan and
Dr. Geisfieler.
So today we're talking about pediatric injuries and our experience with them, kind of what leads to them, what the rehab looks like. So I mean, for myself, I see a ton of soccer athletes, mostly females.
Yeah.
I see a ton of little league players, and in the past, I've seen a lot of figure skaters, gymnasts, dancers, and people dancing and figure skating is a contact sport. And the injuries are pretty alarming, especially when you get into deep into the season. There's not really like an off season for those sorts of things.
No, and I could even, just seeing children who are or adolescents involved in several different sports. Not only do they never get an off season, but sometimes the seasons overlap. Now they're participating in multiple sports, training seasons, and practices on top of each other.
Yeah, I mean, I think the research also shows that being a multi-sport athlete is good for you.
Mm-hmm.
But I think the biggest problem that you're alluding to is kids are often overworked, especially when it comes to specific sports. So, for example, like, kid is a pitcher and he's throwing 9 months out of the year. He's definitely going to see some wear and tear there that, could be a problem later. And then if he's playing a different sport, like, basketball, where he's reaching overhead a lot, that could, lead to some other issues.
Sure. And so you're constantly taxing those same tissues, same joints, same motions over and over again. And then something that I think you've seen this as well, but you can reiterate, is that in the past 2 years, because of the pandemic, I think it's even kicked up another notch.
Oh yeah, absolutely.
Some of these players, not only they're taken out because either there's a small hiatus due to either a lockdown, or they have to kind of take a break because there's a breakout of COVID, and now they're coming back and they're trying to catch up to the season versus that slow progression of strength that we're looking for.
Yeah, I mean, I think that it's like they're trying to catch up for lost time, and it doesn't really work like that. Oh. And diving into the deep end, especially in training, is what I most associate with injuries. Just ramping up way too quickly, and a lot of these kids, especially during the pandemic, they didn't have access to proper training. They weren't moving nearly as much as they were before. And, you get a bunch of kids who's, they've been sitting in front of a TV, or, just going back and forth to school. And then especially maybe less so this year, but last year, you had kids like straight out of quarantine jumping into soccer when they opened up the doors for outdoor sports. And I saw a ton of injuries that I really didn't expect to see.
Sure. I mean, that opens up not only the door to all those tendinopathies that we usually look at, but major ruptures and stuff like that, where, you're going, just like you said, 0 to 100 in maybe a week's time.
Yeah. I mean, I think, especially for the parents out there, I think that, that's one thing that you want to look out for, is to make sure that your kid is not ramping up in sports too quickly, and making sure that they are training in the off season in ways that are different than their sport. For example, we keep on picking on pitchers, but for example, a pitcher, if he's throwing throughout the year and then during the off season, he's doing more coaching for throwing, and that's all he's doing. He's not doing any strength and conditioning. He's not doing any weightlifting or anything else like that. that's kind of a red flag for me, especially if you consider their off season. Their off season should be something that isn't their sport, and they should be getting stronger. They should be getting faster, but in different ways than what their sport specifically is.
Absolutely. Like you said, multi-sport has been shown to be beneficial because you're attacking the body from different spots and just training it so it's not so singular in the training and the strengthening that one sport requires. But yeah, just every professional athlete gets a deload week or a deload period where the strengthening is up, the volume starts to increase, but the power output and the specific training and adaptations for sport are decreased quite a lot.
Yeah.
Because playing a season is very taxing.
Yeah, absolutely. And every professional athlete I've ever treated, whether it's NFL, NBA, Olympians, their off season basically it's kind of nice actually if you think about it. I mean, their off season is basically eating as well as they can, getting as much sleep as they possibly can, basically working out, physical therapy, massage, sauna. I mean, obviously we don't have access to these things. We can't do that stuff. But if we have the ability to get some training and get treatment for those off-season injuries during the off-season and really letting the body recover from the rigors of the season, that's worth its weight in gold. I mean, I'm sure you've seen athletes post, the basketball season or football season just completely smoked, not even just physically, but like mentally.
Sure. And recovery takes form in so many different ways. A lot of it, when we first think of it, is allowing the muscles to relax. But yeah, if you have a adolescent athlete who's taking midterms and is not sleeping because they're stressed and then not eating quite appropriately because which adolescent does, and that's all stress that's coming on the body that's just not primed for recovery. So
yeah, I mean, I can't. I mean, just today I saw a dancer who has had multiple injuries, and I asked them, how'd you sleep last night? And they say, I went to sleep at like 2 and I woke up at 7. I'm like, what? Why? Yeah. It's like, I was watching Netflix. But I'm just like, if you had anyone, any kind of professional athlete or anyone that understands the body, they know that that's not good for them, right? And I think they even know that it's not good for them.
They do, right? But, I think somewhere deep down inside.
But I mean, they're kids at the end of the day. I mean, these are 16-year-olds, these are 12-year-olds, these are 18-year-olds. At the end of the day, they're kids. Like, their brain is not fully functioning. So, I mean, it's up to us as adults and as your parents to really reinforce sleep, hydration. All these kids are dehydrated, like 100% of them. Yeah. They're all, stressed out from other things. I mean, we going through a lot of crises in this world right now, and, leading to anxiety, issues with performance in school. So, I mean, there's a lot of stress on these kids. But when we're talking about injury prevention and like recovery, top 3 things: nutrition, sleep, stress management. All those things play a big role.
Right. And so in terms of nutrition, we know how important, proper protein intake is, but then also those macro and micronutrients to build your system and just to have it working appropriately. You mentioned hydration. Electrolyte balance is so key in just living the day rather than having cramps during the baseball game or anything like that. And then the sleep, research has shown that in your adolescent years, your circadian rhythm totally gets messed up. Your melatonin starts getting produced at different times. So, the typical 7:30, 8 o'clock a.m., school day, going to 2:45 or 3 p.m. is just not conducive to what's going on internally to the body. But that's basically the life we live.
Yeah.
So we have to kind of apply or change the dynamics of that sleep, the hydration, the adequate protein intake where we can to facilitate their recovery. And
yeah, I mean, I think we live it where our clinic is located in northeast New Jersey, North Jersey. And it's just like, every kid has 15 different things going on at the same time. And a lot of the complaints I get from the parents is like, yes, I would love for them to eat better. And I would love for them to be hydrated. I would love for them to sleep more, but there's just too much going on. And then sometimes, you have to question, when is too much, right? Sometimes we need to prioritize, like, is this more important than this? Is this more important than that? And sometimes you just need to make better decisions. Like Wendy's on the way to practice, probably not the best decision. Maybe a protein shake and, some fruit, or maybe, some supplementation in terms of nutrients could be helpful. And those are all like kind of nitty gritty details you get into that you would want to, work with somebody with. But I think, talking about stress management and how much, meaning stress management, meaning like load management in terms of how much they're doing on and off the field, nutrition, and some of the other factors that we can't necessarily control in terms of hydration, sleep, stress. What are some other components that you find deal or kind of play into kids and injuries?
So we kind of alluded to before, but just that progressive loading where you're not just jumping from one thing to another, or you're coming from class and all of a sudden you're jumping up and you got to immediately run and start getting into a warm up. And we've all been there where you have to bring your kids there slightly late, so they have to jump into practice that without the adequate warm up. So just really treating the body like you're a upper level athlete, because in the end of the day, performance is performance, and you need appropriate warm up and then progressive loading to not put your body in a situation where it's not adapted for.
Yeah, absolutely. I suffered a really, really bad injury, specifically for that reason. I was much younger at the time, but I, was doing a powerlifting block, and then it was really early in the morning. I didn't have time to warm up, and they were already in the groove of it. So I jumped in there and tried to do a lift, and my back went out. If I had warmed up and kind of progressed my way into it, I probably wouldn't have been hurt. That injury led me to years and years of pain, just from that one incident. And I know your parents out there want to avoid those sorts of situations, and I'm telling you, it could happen very quickly. And exactly like you're saying, improper warm up and cool downs is a huge factor when it comes to injuries, and something that has really, really serious consequences. It's not like, kids are resilient, but you could suffer some pretty horrific, long lasting, permanent issues by not warming up properly.
Yeah. And I hear parents, do say that, where they're like, oh, kids bounce back and they can handle, at that age, you can handle that. When you get to be our age, you can't. But like you said, it really just takes one injury, and that can have a cascade of events that really kind of affect you for years to come, or maybe your entire life. So
yeah. Yeah, and I think improper rehab, like once you're injured, there's a lot of things that go into recovery, right? And I think the biggest problem is that a lot of PTs and a lot of rehab specialists, there's a lot of great ones out there. But I think that a big part of the problem is that we're constrained by insurance, and we're constrained on timelines. We need to get these kids back on the field as quickly as possible. And at the end of the day, if they are not fully recovered, or if they have not checked off those boxes to really signify to us that they are ready to get back, I'll be very frank with parents and tell them, like, I don't think that they're ready to go back yet. And I've dealt with, very strong words from coaches and parents where I felt like I was the only advocate for the kid. I was like, this is not even my child. Like, I feel like I care more about their well-being than you do. I know that's not any of you guys out there. But I think that especially with rehab and recovery, if they have some injuries, it's really important to get it addressed correctly. And it's really important to get it addressed in a timely manner, in that we feel that we've actually completed our objective.
Absolutely. Yeah.
Right. I mean, like, I think about, some of these girls that have been playing soccer, they blow their ACL, and then, they want to make that last game of the season.
Sure.
But a lot of times it's not worth it.
Right.
It's not worth the risk.
Yeah.
Yeah. All right. So, is there anything else you want to talk about?
No, I mean, I think our main, points were to adequate warm up, cool down, and proper progression, and making sure we fortify the things that we can, because sometimes you can't control everything, which would be nutrition, sleep, hydration, and just adequate recovery.
Yeah. So that's it for today's broadcast. If you guys have any questions, feel free to leave a comment below, and we'll see you on the next podcast.